Does your furry friend take over your bed every night? It's time to reclaim your space while giving them the comfort they deserve with the coldest, cozy dog bed. Don't wait. Check out the link in the video description to buy now on Amazon.
A GP hatched a plan to supply fake COVID-19 vaccination certificates to patients who hadn't had the jab in return for cash, a medical tribunal heard. Dr. Sonali Mukherjee Bose devised the scheme while working at the Barrelby Surgery in West London and Zen Healthcare, which provides private GP appointments at its 5 branches across the city. A fitness to practice panel of the Medical Practitioners Tribunal Service was told that the medic approached a junior employee, known as Mr. A, to help her create the false vaccination certificates on the secure clinical platform that stores vaccine data for the NHS, known as Pinnacle. In return, she promised him good remuneration, saying he would be able to earn his entire month's salary in just a few hours. Dr. Mukherjee Bose said she had many waiting for the certificates and told him it was easy work with no risk. She also asked him if a colleague, referred to as Person B, would also get involved, saying they would both be paid for their help. In one of the texts sent to Mr. A, in October 2021, Dr. Mukherjee Bose wrote, "This is an excellent opportunity, maybe, Person B, can help. Please, can we speak this evening? I have many waiting." Another said, "Happy to speak to Person B, 2OT, sick, is easy work, there is no risk and good remuneration, you would probably make same as your salary for a couple of hours work a month." Mr. A claimed Dr. Mukherjee Bose, who was appointed an NHS appraiser for Central and North West London in 2016, also asked him to backdate certificates of the Pfizer jab and asked him if he knew Pfizer vaccine batch numbers. He didn't reply to the texts but reported them to his manager, who referred the matter to another doctor, who in turn reported Dr. Mukherjee Bose to the medical watchdog, the General Medical Council. They launched an investigation and, the tribunal heard that, when questioned, Dr. Mukherjee Bose accepted sending the texts and that she'd intended to create the false COVID-19 certificates for people who were unvaccinated and not patients at her surgery. Dr. Mukherjee Bose claimed a private Russian patient and 2 other individuals, who had received the jab abroad and were living in the Middle East, had pressured her for the fake documentation. She said she was acting under duress from external parties and never went ahead with the idea after concluding it would be morally wrong. But the tribunal noted there were inconsistencies in her evidence, especially surrounding exactly who had contacted her for a fake certificate and their nationalities. Dr. Mukherjee Bose, who qualified at Imperial College in London in 1993, denied all the charges against her, but the panel found her guilty of misconduct. In their determination, the tribunal said, Dr. Mukherjee Bose stated that, "If these messages were sent by me, it is the worst possible thing I have done in my career." She frankly accepted that if an incorrect COVID vaccine batch number was added to a medical record for a patient who had received the vaccination outside of the UK, that this would be dishonest. The tribunal has determined that not only was she requesting certificates for individuals who had not received COVID-19 vaccination in the UK, but also for persons who had not received COVID-19 vaccination. They also found she had deleted the texts to Mr. A and falsely claimed they had been lost when she rebooted her phone to cover up what she had done. Dr. Mukherjee Bose may face being struck off when it reconvenes in January if the panel decide her fitness to practice is impaired by reason of misconduct.